So here are the things that I really want women who are above 40 to know about. Number one, high blood pressure. So many patients tell me, I don't even know what my blood pressure is. You really have to understand what your blood pressure is. So you don't need to understand the physiology behind how we calculate it, but you need to understand what a normal blood pressure is. So just for your knowledge, a normal blood pressure requires two numbers, a top and a bottom number, systolic and diastolic. 120 over 80 is considered a perfect blood pressure. We really start to worry when the top number, the systolic blood pressure, is above 140, or the bottom blood pressure is above 90. Now, there are some variations in the cutoffs based on if you are diabetic or not, but an average woman, an average blood pressure, if your blood pressure systolic is above 140 or diastolic above 90, the bottom number, either or, this is high blood pressure. If you go to the Heart and Stroke Foundation or Hypertension Canada, they actually have a little printout about what high blood pressure is, how to calculate it, and they even have a printout on how to write down your blood pressure and have like a little log. So knowing your blood pressure is very important because that is a #1 cardiovascular risk, and it is a silent killer. High blood pressure is a silent killer. So knowing your blood pressure is very important. Number two, obesity. So we have different cutoffs based on your BMI, and I know it's not perfect because if you are somebody who's lifting weights and a weight trainer, you will naturally have a higher BMI, yet your body composition is primarily muscle. So BMI is one sort of indicator. It's not perfect, but it's something that is, used in general practice. So a BMI above 25 is considered elevated. And so knowing what your weight and height is very important as well, because you need to be able to understand how to input these values into your risk score, which I will come to. The next thing is your cholesterol. So across the country, cholesterol values are interpreted differently. The cutoffs are a little bit different based on the lab that you use, but there are some general cutoffs as well. And so if you've never had a cholesterol or a lipid level drawn, it's very important that you ask your family doctor at any age to have this done, because even if it's normal, at least you have a baseline. So the cholesterol is made of an LDL cholesterol, which is the bad cholesterol, and HDL cholesterol, which is the good cholesterol. There's also something called triglycerides, which are also important to know. And there are a couple of other LDL particles which are not part of the standard testing. The LPA, or lipoprotein A particle, which again, you need to specifically ask your doctor to order. But that is a blood test, which is another marker of high cholesterol. And if that is elevated, it's really elevated because you have an underlying genetic risk. That LPA article is connected to chromosome number 6, which is elevated regardless of your age, your gender, whether you're fasting or not fasting. And so that value, if it's elevated, is very, very important information to know whether you are at risk of having high cholesterol. Cholesterol is plaque in the arteries. So if you just think about, a blood vessel, the more plaque you have means the higher cholesterol you have. And the more plaque you build up, the smaller the opening of that blood vessel. And at some point, if that blood vessel gets completely occluded or blocked off because of your high cholesterol, you will then develop a heart attack or stroke, or that tissue that's being perfused from that blood vessel is going to then no longer have oxygen and then become ischemic, essentially. And so that's when you develop a heart attack if it occurs in the arteries of your heart, or a stroke if it occurs in the arteries in your brain. So knowing your cholesterol is very important to your overall cardiovascular risk. Diabetes and sleep apnea is also important as well. Poor diabetic control can contribute as well. And having sleep apnea is sort of another symptom of cardiovascular disease that is often missed. Many patients will go to their family doctor and say, I'm tired, but don't realize it could very well be sleep apnea. In women, it doesn't present typically like in men. As I mentioned, again, men are different than women. You'll think about white, overweight males as having OSA. Women sometimes can present with actually just being irritable or depression. Actually, depression and irritability can very well be a symptom of sleep apnea. So if you don't ask your doctor to send you for a sleep study, you very well may be missed, and you don't need to be overweight to have sleep apnea. So it's really important that you consider that as part of your diagnostic workup and your heart health risk as well. The last thing I want to talk about with midlife is early menopause. So women who go into early menopause, which we define under the age of 45 or under the age of 40 for premature menopause, are at higher risk of cardiovascular disease because even though we know estrogen is pro-thrombotic or increases risk of clot, it actually is very protective to your heart as well. And so having estrogen is important for your heart health. If you go into menopause early for various reasons, you no longer have estrogen, so you are at risk of developing cardiovascular disease earlier. So being on hormone replacement therapy is very, very important for women in early menopause. And if you are in that category and your doctor has not talked to you about that, it's very important that you get that information and ask to be referred to a hormone specialist or a menopause specialist or an endocrinologist to get that help.